Health Hub. Today, we're going to talk about a very exciting initiative at the VA Maryland healthcare system that uses AI. It's called Ambient AI Scribe. And here to talk to us about it is Dr. Aaron Jacoby. He is the acting deputy chief of staff for the VA Maryland healthcare system. Tell me about Ambient AI Scribe. What is it?
Essentially, what it is it's using and leveraging artificial intelligence, AI. We've been hearing lots about this in the country, to essentially be present during a visit when a veteran comes in to see their primary care physician. And Ambient AI Scribe is essentially a digital interface that listens in on the session that happens between the patient and the physician. And it uses AI technology to essentially transcribe or record the interactions that occurred during the visit. It's not just a straight recording, though. It actually leverages and uses artificial intelligence to summarize the content of the visit. And what's nice about that is it allows for a veteran to have much more face-to-face time with the primary care physician. And it allows the primary care physician to actually spend more time focusing on the veteran's care needs and not as much on some of the routine kind of practice issues that come into play, like typing into a computer and reviewing medical records on a screen.
Imagine that will be welcome by many patients because, like you said, the physician it's an interaction rather than the physician looking on their computer the whole time and typing. In my own personal healthcare, I've noticed that during appointments that it seems like the physician's not listening to you. They are, but they have to keep taking notes. And so, trying to accomplish two things at one time is difficult. So I imagine that our clinicians are looking forward to this too.
They really are. This is being rolled out across the country in primary care. And our primary care physicians here at VA Maryland are excited about it. They're interested in doing this pilot, and they're really interested in leveraging technology to improve their efficiency. What we're hearing from them is, as we embark upon the go live date that's scheduled later in March, we're doing all the setup that we need to get together. We got to get the microphones in place. We got to make sure that people are trained. But once we roll it out, we're excited because we think that it's going to help make the visits much more efficient with veterans. What we're hearing from across the country, because there have been 10 sites that this has been rolled out to late this past fall as well as early in the winter, we're hearing feedback, good feedback, positive reception from veterans who are saying that they feel like they have more time to talk to their primary care physician. They feel like their primary care physician has more time to spend with them, and that this ambient AI scribe technology is just making everything much more efficient. We're also hearing from the primary care physicians at the pilot sites that they're really liking it too. It's speeding up their documentation, so they're spending less time writing notes. They're able to actually look at the transcription following the interaction with the veteran and just quickly edit it and sign it. So they're getting their notes signed faster. And veterans are able to actually see their signed notes faster in My Healthy Vet when they go and look at their medical records. So all around, we're hearing really rave reviews.
The veterans are able to see this transcription themselves.
They'll see the final product just like they normally see in their medical record. So the transcription will be seen by the primary care provider. They'll make some slight edits to it to make sure that it's ready for viewing. And then once they sign that, the veteran can go in. So we're hearing from veterans that they're able to see their medical records faster with this use of this technology, which is really helpful. Veterans, when they come in for an appointment, they want to know that not only did they see their doctor and they got to ask their questions, but afterwards, if they maybe forgot something, they go and they look in their medical record and they see, like, hey, did I get that right? The fact that it's there faster for them, I think, really helps people feel like the whole process of care is just much more efficient.
Walk me through what the patient will see. What will a visit be like? Is there like lights, camera, action? Is it going to really change the atmosphere of an exam room?
It won't. It's actually going to be really similar. So the only thing that's different is that when the veteran comes into the visit, there is a consent process. Essentially, the primary care doctor is going to ask them, do I have your permission to use this technology? And what we're hearing is that veterans are very open to and embracing this technology. They really like it. And, most veterans are saying, sure, use that technology, anything to make my visit, more streamlined and easy. And so once they do the consent process, essentially, Ambient AI Scribe just works in the background. It listens to the visit, it summarizes it, and then the physician gets that. They quickly review it and they sign off.
Patient privacy is the utmost importance at the VA. We are trained to always be on the lookout for any kind of privacy violation or privacy, issue. Can you talk about the patient privacy aspect of it?
Definitely. So the Ambient AI Scribe has been fully vetted, and it is a, very safe and secure technology that interfaces directly with our medical record. So we've been working in the pre-implementation phase really closely with our clinical informatics team, the folks that essentially look at all of our medical records and getting ready for this initiative. So there's a note title that primary care physicians know to use. That note title is linked directly to the Ambient AI Scribe technology. And essentially, when it's listening in on the session, it's populating it right into the medical record as a draft. And the physician then edits that draft. So it never leaves anywhere. It stays within the facility. And the only time that it can be viewed as once it's essentially a signed note, which is the same exact way that it already works for the medical record. So it's very secure, very safe. People have asked questions about, the safety, and what we're hearing is that, there have been no concerns at any of the pilot sites for privacy. Veterans really feel like this is an excellent technology, and it's really helped, improve their visits.
Dr. Jacoby, in your role as acting deputy chief of staff, you're still seeing patients on a regular basis. So, have you addressed this with them just to feel them out and see what they think about this?
We're rolling this out in primary care to start. There is some discussion about expanding it to medicine specialty teams, mental health professionals. I happen to be a psychologist by training, and so that's coming in the future. I haven't had any conversations directly with my veterans because we haven't rolled it out within mental health, but I know it's coming because it's the type of technology that I think is going to really help, launch us into, the next band of, care that we provide. What I do know is that at the pilot sites that have rolled it out, the primary care physicians that are having those discussions with their veterans, they're answering the questions about, how safe is this? Is it secure? Is it private? And what we're hearing is that, yes to all of those questions. It's very safe, it's very secure. And veterans really like it. They like it because, again, they get to spend much more face time with their physician. And the more time that you can spend face to face talking about your concerns, I think, that goes a long way for patient satisfaction.
And this doesn't mean that your physician is no longer going to look at the computer. I mean, they have to because it gives them maybe they're watching somebody's blood pressure. They want to see what it was the last time, or all any other health testing that was done the last time. That kind of thing. So they will still need to access the computer. It's not like it's going to be hands free the whole time.
Definitely. Physicians, they're going to be looking at laboratory values. They're going to be sharing their screen with the veteran saying, here's what your blood values look like. Here's what some of the other test results will look like. A lot of times they're looking at imaging results. So they're looking, did somebody get an x-ray? And we're going to look at that x-ray and see what the report says. So they'll still be incorporating all of those types of test reviews into the meeting with the veteran, as they should. What's nice about Ambient AI Scribe is that it's constantly working in the background to summarize that discussion. So even if they're looking at test values or images, it's going to be, listening to the conversation that's being had between the physician and the patient, and gathering all that information so that it's summarized in the notes, so that nothing gets missed essentially in that discussion. What we're hearing is that it's leading to much more complete documentation, so that when the veteran goes in to look at their record in My Healthy Vet, they're seeing, that information, and they have fewer questions.
And they're probably able to develop an even closer and more fulfilling relationship with their physician.
They don't have as many of those, minor interruptions that already occur. When you're looking at a screen, you might be typing on the computer. Even though we know the physician is listening, it still feels a little bit less connected for the veteran. If the veteran is spending most of their time looking eye to eye with their physician, it really helps with that connection, that bond. Because again, that relationship between, the veteran and the physician, that's important. You have to make sure that you develop a level of trust, a level of respect. And I think this technology really helps that whole process.
It sounds awesome. Many people don't know that the VA Maryland healthcare system is really up on many, many innovations and new technology.
We are really trying to stay on the cutting edge and leveraging and using technology to really improve the care that veterans receive. And this is just one example of, some of the things that we're doing. We are going to be sending information out and getting the word out. And so, really what I'm hoping is that as veterans learn more about Ambient AI Scribe, they're going to be talking with their fellow veterans about, hey, I went to my visit and I just had this, experience, and it really was cool. And getting the word out. We always can depend upon our veterans to share their experiences with one another. And so that's the message I'd like to get out, is let's get the word out and let's get people excited about this really cool new technology. Just like anything, we're going to see that it's going to improve healthcare, and that's what we're here for.